Hello everyone. We are going to discuss about the androgens and the related drugs. Under this heading, we will discuss the androgens, actions, its pharmacokinetics, and anabolic steroids. So, androgens. What are androgens? Androgens are the substances which causes the development of secondary sexual characters. Its endocrine function is established by the Berthold in 1849. Androgens are of two types, natural androgens and the synthetic androgens. So what are the natural androgens? The testes of adult male produces a 5 to 12 mg and testosterone daily. Testosterone converted into the dihydrotestosterone by the steroids 5-alpha reductase. Adrenal cortex produces the dehydroepiandrosterone and the androstenedione. Together they are called as the weak androgens. In women also testosterone produced by the ovary in small quantity, and together this leads to the production of a 0.25 to 0.5 mg per day. Synthetic androgens. Methyl testosterone and fluoxymesterone are the 70 alkyl substituted derivatives of testosterone. Orally active due to the resistance to the first pass metabolism and its submaximal androgenic activity, and has a potential to cause the cholestatic jaundice. Regulation of a secretion. Testosterone is secreted by the interstitial Leydig cells of a testis under the influence of LH from pituitary. The high concentration of a testosterone inhibits the LH secretion and causes the atrophy of interstitial cells. The small amount of estradiol and is produced by the testis as well as that generates from the testosterone to estradiol in liver. The testosterone and estradiol act on the hypothalamus to reduce the gonadotropin releasing hormone and act directly on the pituitary. In women, testosterone is produced by the corpus luteum and the adrenal cortex. So, what are the actions of androgens? First, it acts on the sex organ and secondary sexual characters. The testosterone responsible for all the changes that occurs in the body of a boys at the puberty, that is growth of genitals like a penis, scrotum, seminal vesicle and the prostate, growth of hairs in the pubic, axillary, then the body hairs, thickening of a skin which becomes a greasy due to the proliferation and increase the activity of a sebaceous glands. Behavioral effects are also seen, that is increased physical vigor, then aggressiveness, penile erection, male libido activated by the testosterone. It also acts on the testes. The large dose of testosterone causes the testicular atrophy by inhibiting GN secretion from the pituitary. Testosterone is needed for the normal spermatogenesis and maturation of a spermatozoa. On the skeletal muscle and the skeleton, testosterone is responsible for the pubertal spurt growth in the boys and to some smaller extent in girls. Causes the bone growth, that is both involving the thickness as well as the length of the bones, muscle building, and it also acts on the erythropoiesis. Testosterone accelerates the erythropoiesis by increasing the erythropoietin production and also helps in the heme synthesis. So the androgenic drugs are as follows. It includes the androgens, anabolic steroids, anti-androgens, 5-alpha reductase inhibitor. Later we will discuss on the what are the 5-alpha reductase, and drugs for the erectile dysfunctions like androgens, phosphodiesterase 5 inhibitor and the intracavernosal vasodilators. Mechanism of actions. So the testosterone is the large circulating hormones in the male, and in target cells the 4 to 5 double bonds reduced to produce the dihydrotestosterone. We had seen that the testosterone converted into the dihydrotestosterone by the 5-alpha steroid reductase hormone. Dihydrotestosterone binds to the androgen receptors more avidly. Formation of a more active complex than the testosterone receptors complex in a combining with the DNA. Androgen receptors, after combining with the androgen response element of target gene, and then the DNA transcription is enhanced or repressed with the help of a co-activators or the co-pressors, which may tissue specific. The testosterone itself appears to be the active hormone at a certain sites such as the fetal genital rudiments, then the hypothalamus, pituitary sites involving the feedback mechanisms, erythropoietin cells, then spermatogenic cells. 5-alpha reductase enzymes exist in the two isoforms, that the 5-alpha reductase 1 and the 5-alpha reductase 2. We had seen that this enzyme is inhibited by the drugs also. The pharmacokinetics. It is inactive orally due to the high first pass metabolism. The ethanoate, cypionate, and the isocaproate, decanoate esters are the long acting and can be injected every 2 to 4 weeks. 98% of the testosterone in a circulation is bound to the sex hormone binding globulin, that is SHBG, and to the albumin. Metabolic products are excreted in the urine also. So what are the side effects? Androgens can cause the virilization and the excess of body hairs and menstrual irregularities in the women if they are raised above their normal levels. And second is the acne. Both in the males and females, it causes the acne, oligozoospermia, then the frequent, sustained, and often painful erection in the males, then the salt retention and the edema in the patient with the heart and kidney diseases, then gynecomastia, cholestatic jaundice, and the lowering the HDL and increasing the LDL level. Uses of the testosterone. It is used in the testicular failures, then hypopituitarism. Hypogonadism is one of the feature of hypopituitarism, and it is used in that. The AIDS related muscle wasting. As we know that the testosterone is used in the muscle building, so we are using it in the AIDS related muscle wasting. In hereditary angioneurotic edema, then aging, testosterone decreases in the old age. It has administered too early to aid with improving the bone mineralization and muscle mass. Testosterone helps in the bone growth and the thickness, so it is used in case of aging. The idiopathic male infertility. What are the anabolic steroids? These are the synthetic androgens with the high anabolic and lower androgenic activity. The drugs includes the nandrolone, oxymetholone, stanozolol, and the methindione. Uses. So, what are the uses of the anabolic steroids? First, it includes the osteoporosis, suboptimal growth in the boys, then the hypoplastic, hemolytic, and malignancy associated anemia. To enhance the physical ability of the athletes, anabolic steroids are also used. So we will shift to the MCQs. Which of the following is not action of androgen? Bone thickening, erythropoiesis, muscle building, and oligozoospermia. So the answer of the first MCQ is oligozoospermia. Second MCQ is plasma level of testosterone in adult male is option number 1 0.3 to 1 microgram per dl, 2 20 nanogram per dl, 3 0.4 mg per dl, and 4 is 0.3 to 1 mg per dl. Its answer is 0.3 to 1 microgram per dl. Third MCQ is which of the following is not the effect of androgen? Option number 1 oligozoospermia, second cholestatic jaundice, third ototoxicity, and 4 gynecomastia. So the answer is 3 ototoxicity. The last one is the deficiency of the 5-alpha reductase leads to the following. First, pseudohermaphrodism, second testicular atrophy, third nystagmus, and the fourth tumor of the testes. So its answer is first, that is the pseudohermaphrodism. Here I am done with my topics. Thank you.